Welcome to our training session on signs and symptoms of disease and illness. Training objectives. In this training, we will focus on developing the skills necessary to identify key signs and symptoms of illness in individuals under your care. By the end of this session, you will understand the difference between signs and symptoms, learn to distinguish between observable, objective signs and subjective symptoms reported by the person in your care. Recognize common signs and symptoms, gain the ability to identify early warning signs in areas like fever, fatigue, respiratory distress, and cardiovascular or neurological changes. Know when to seek medical help, learn how to determine whether a symptom requires emergency intervention or if it can be addressed through regular healthcare support. Enhance your caregiving role, strengthen your ability to monitor, report, and communicate effectively with healthcare professionals, ensuring that your care is timely and responsive to health changes. By being alert to these signs and symptoms, you will play a key role in safeguarding the health and well-being of the individuals you care for. Introduction to signs and symptoms. Signs, objective, observable changes that a person can see, feel, or measure, e.g., fever, rash, labored breathing. Symptoms, subjective experiences or complaints reported by the person being cared for, e.g., pain, dizziness, nausea. Why this is important. Early identification of illness or changes in condition can prevent complications. It helps ensure the person in your care receives the appropriate medical attention as quickly as possible. Caregivers play a critical role in the health and well-being of the individual, and being alert to signs and symptoms is key to providing high-quality care. Key signs and symptoms to watch for, Part I. General symptoms. Fever, signs, elevated body temperature, over 100.4 Fahrenheit or 38 Celsius, shivering, sweating, flushed skin. Action, use a thermometer to confirm the fever. If it persists or is over 101 Fahrenheit, notify a healthcare provider. Monitor for other symptoms, e.g., chills, fatigue. Fatigue or malaise, signs, unexplained tiredness or weakness. Loss of energy, reluctance to engage in usual activities. Action, encourage rest, keep the individual hydrated, and monitor for worsening fatigue or additional symptoms. If fatigue persists for days, report it to the healthcare provider. Respiratory symptoms. Shortness of breath, dyspnea, signs, rapid or shallow breathing, difficulty breathing, or feeling winded after minimal activity. Action, help the individual sit upright or find a comfortable position. If breathing difficulties are severe or worsening, call 911. Cough, signs, a dry or productive, mucus-producing cough that lasts more than a few days. Action, document the type of cough, how long it's been occurring, and if it's worsening. If it's accompanied by fever, report to the healthcare provider. Wheezing or stridor, signs, high-pitched sounds when breathing in, stridor, or whistling sounds during exhalation, wheezing. Action, this may be a sign of airway narrowing or asthma. If the person is struggling to breathe, seek immediate medical attention. Cardiovascular symptoms. Chest pain, signs, complaints of tightness, pressure, or pain in the chest. This may radiate to the arms, back, neck, or jaw. Action, chest pain could indicate a serious condition like a heart attack. If the pain is severe or persistent, call 911 immediately. Swelling, edema, signs, swelling in the legs, ankles, feet, or abdomen. Action, elevate swollen legs or feet, monitor for additional symptoms, e.g., shortness of breath, weight gain, and report to a healthcare provider. Palpitations, signs, the person feels their heart racing, skipping beats, or beating irregularly. Action, check the pulse, monitor for dizziness or fainting. and contact the healthcare provider if palpitations persist. Neurological symptoms. Headache, signs, persistent, severe, or unusual headaches that don't respond to usual pain relief methods. Action, assess the individual for additional symptoms such as nausea, sensitivity to light, or changes in vision. If the headache is severe or accompanied by other neurological signs, report it to the healthcare provider. Dizziness or lightheadedness, signs, the person feels faint, lightheaded, or like they are about to fall. Action, have the person sit or lie down, make sure they are in a safe environment. And monitor for worsening symptoms. Report to the healthcare provider if dizziness persists or worsens. Seizures, signs, uncontrolled shaking, twitching, or jerking movements, loss of consciousness. Action, protect the person from injury by clearing the area, placing a cushion under their head, and turning them onto their side to keep the airway open. Time the seizure, and after it stops, contact emergency medical services, 911. Gastrointestinal symptoms. Nausea/vomiting, signs, complaints of nausea, and actual vomiting, which may be accompanied by dizziness or abdominal pain. Action, provide a calm environment, offer small sips of water, and allow the person to rest. If vomiting persists or is accompanied by other concerning symptoms, e.g., fever, abdominal pain, report to the healthcare provider. Diarrhea, signs, frequent watery bowel movements, which may be accompanied by cramping or bloating. Action, keep the person hydrated, especially with electrolyte solutions. If diarrhea lasts more than 24 hours or is accompanied by fever or blood, notify the healthcare provider. Abdominal pain, signs, complaints of pain, discomfort, or bloating in the stomach or lower abdomen. Action, check for signs of nausea or vomiting, and determine if the pain is localized, e.g., appendicitis. If the pain is severe or persistent, report it to a healthcare provider. Urinary symptoms. Painful urination, dysuria, signs, complaints of burning or pain when urinating, along with urgency or frequency. Action, encourage increased fluid intake, and help the person maintain good hygiene. If symptoms persist or are accompanied by blood in the urine or fever, contact the healthcare provider. Changes in urine, signs, cloudy, foul-smelling, or blood-tinged urine. Action, note the appearance of the urine, and report any changes to the healthcare provider. Skin symptoms. Rashes, signs, red, inflamed, or raised patches of skin that may be itchy or painful. Action, identify whether there are other symptoms, such as fever or swelling. If the rash appears severe or is accompanied by difficulty breathing or swelling of the face, seek medical attention immediately. Bruising or bleeding, signs, unexplained bruising, bleeding from the gums, nosebleeds, or unusual cuts that don't stop bleeding. Action, if bleeding is severe or the person shows signs of anemia, e.g., fatigue, pale skin, contact the healthcare provider. Behavioral and cognitive symptoms. Confusion or disorientation, signs, difficulty understanding time, place, or people, memory loss, trouble following simple instructions. Action, this may be a sign of a more serious issue like infection or dehydration. Monitor for other symptoms like fever or lethargy, and report to the healthcare provider. Changes in mood, signs, increased irritability, sadness, depression, or sudden mood swings. Action, provide emotional support, engage the person in conversation, and monitor for any signs of self-harm. Report any significant changes in behavior to the healthcare provider. When to seek medical help. Emergent symptoms, call 911 immediately, chest pain or discomfort. difficulty breathing or shortness of breath, sudden severe headache or visual disturbances, seizures, unresponsiveness or loss of consciousness, heavy bleeding or trauma, non-emergent but concerning symptoms, contact a healthcare provider, persistent fever or chills, severe fatigue or weakness, sudden confusion or memory loss, persistent cough or breathing difficulties, unexplained pain, e.g., abdominal, chest, or head, change in mood or behavior. The role of the caregiver. Monitoring and reporting. Be observant and vigilant for any signs or symptoms that may indicate a health issue. Document changes in behavior or physical condition and report them promptly to the appropriate healthcare professional. Effective communication. Keep open lines of communication with the individual's family members, healthcare providers, or medical team. Be clear, concise, and accurate when describing symptoms and any changes observed. The role of the caregiver. Documentation. Maintain accurate and detailed records of symptoms, interventions, and communications. This helps ensure continuity of care and assists healthcare providers in making informed decisions. Responding to health concerns. Remain calm and reassure the individual in your care. Understand the importance of seeking professional help when needed and not delaying care. The role of the caregiver. Infection control and prevention. Hand hygiene. Wash your hands regularly, especially before and after assisting with personal care or meals. Use of personal protective equipment, PPE. Wear gloves, masks, or gowns when handling bodily fluids or caring for individuals with contagious illnesses. Disinfection. Regularly clean surfaces, shared items, e.g., remote controls, doorknobs, and personal care items. Thank you for watching the Signs and Symptoms of Disease and Illness Training module. Please answer the questions for this training before moving on to the next training module.